it time to switch to Covered California? Well, let's find out. Hi, I'm Kevin Knaus with InsureMeKevin.com. And Covered California is going to be putting on a big advertising blitz here in the middle of April going forward in 2021 to alert everyone about the new larger subsidies that are available to higher income earners and also for people who have no health insurance, and hopefully draw them into the insurance pool through Covered California. However, before you just jump into those waters, there's probably a few things you need to consider. First, COBRA. If you have lost employer-sponsored health insurance due to a slowdown and involuntary termination from your employer, you may be eligible to have your COBRA premiums covered 100% through September. And of course, that's better than paying anything through Covered California. So you will want to check with your Human Resources Department to see if you qualify for the COBRA 100% coverage. Next, if you have a grandfathered plan, and grandfathered plans were those health insurance products before the ACA, Obamacare, came online in 2014. And they generally are less in cost. They don't always have the same benefits. Maybe the member cost sharing is a little bit different, but usually the overall rates are much lower. People are generally happy with their grandfathered plan. So if you have a grandfathered plan, you may not want to jump ship right away. You'll want to compare the benefits to the new Covered California plans. And I will say that the ACA compliant Covered California plans do have more benefit coverage for certain, like mental health and things of that nature. So you will want to seriously look at that because they are more expensive through Covered California. But of course, if you're getting a big subsidy, that may be the big offsetting factor. Now, there are other plans offered by the health insurance carriers that are what they call non-standard benefit design plans. They are only offered to off-exchange consumers. Now, Covered California is considered on exchange because it is the exchange under the Affordable Care Act. Off-exchange is when you buy a health plan directly from the carrier with no subsidies. The only way to get a subsidy is to go through Covered California, but some of the plans that the carriers are compliant are not offered on Covered California. Kaiser has several bronze and silver plans, a high deductible HSA compliant silver plan that is not available through Covered California. Blue Shield has some, Blue Cross. So there are many out there, and if you like that plan, it's not going to be offered on Covered California, so you'll have to drop it. And generally, those plans are less expensive than some of the comparable products through Covered California. And if you're not getting a big subsidy, it may not be worth it to give up that non-standard benefit design plan. And those non-standard benefit design plans, they are a little bit different from the standard bronze 60, silver 70, gold 80, and platinum 90 benefit plans that are offered through Covered California. And those plans are also offered off exchange the exact same rate as what you get from Covered California, except the silver plans. And we'll talk about that. One of the items that Covered California has worked with the health plans on is for people that have an off-exchange plan coming into Covered California is the transfer of any accumulated member cost sharing. That's money that you have spent meeting any deductible, co-pays, and co-insurance to meeting the maximum out of pocket. And Covered California has worked with, I guess, all of the different health plans to transfer those. So you shouldn't lose anything. So if you spent $1,000 towards meeting any particular deductible in your plan, when you go to Covered California, that $1,000 should follow you in that deductible column. However, there may be some hiccups and you'll really need to investigate this. For example, I'm not sure if grandfathered plans, and because there's benefit structure and the member cost sharing is a little bit different, if those dollars will properly transfer over. I have also read that it needs to be from like plan to like plan, so from a Bronze 60 off exchange to a Bronze 60 on covered California. And generally, when you go from, say, an HMO to a PPO, none of that ever follows because it's like starting a whole new plan. So you'll really need to look at that carefully, even though Covered California may say that those dollars will follow you. You know, we need to get absolute certainty before you make that decision. Because if you've already met your deductible or something like that, and you switch to a Covered California plan and it's like starting all over again, you know, that's not worth it sometimes. Now, like I mentioned, the Silver 70 plans, they are priced differently. There is a surcharge on Covered California plans. You can get almost an exact mirror of a Silver 70 plan off exchange for 10 to 15% less, because the Covered California plans have a 10 to 15% surcharge. It is only the Silver plans that have this surcharge. In other words, they're artificially inflated above the base rate. The Bronze, the Gold, and the Platinum plans have the exact same rate. So that's one thing to consider, is that if you're going to be getting a subsidy, the subsidy needs to be large enough to cover the increased cost of a Silver plan, if that's what you're getting, to bring it down. And of course, the subsidy should probably be low enough to make it economically interesting to even think about it. But that is one hitch. The Silver plans are more expensive, so if you're not getting a subsidy or very little, it may not make any sense to go through Covered California. Now, another odd thing, and there are many people that are not in Covered California because they don't make enough money. Seems kind of odd, but true, that the subsidies are based on your income. In California, we have expanded Medi-Cal. So any adult with an income under 138% of the federal poverty level is considered Medi-Cal eligible. And if you have a household with children, ages 19 and younger, if the income's under 266%, the children are Medi-Cal eligible. Now, there's many people that have plenty of resources to pay for health insurance, but they don't have any taxable income, and that's what you need in order to qualify for the health insurance premium tax credit subsidies. Is you need that modified adjusted gross income in order to qualify, and of course it has to be above that certain percentage. So if you don't have that, it may not be worth it to switch. Now, how big are the subsidies? The subsidies they're fairly large, especially in the lower incomes, but the really, really big thing is that the subsidies are available to people with much higher incomes. Before the American Rescue Plan, the federal subsidies cut off at 400% of the federal poverty level, which is okay in many parts of the country, but hey, this is California and it's expensive to live, and the incomes are just higher. So now, like from this graph here, two adults, both age 55, living in Los Angeles, they can get a subsidy up to 950% of the federal poverty level. And the way the subsidy is calculated is it works off of the second lowest cost Silver plan. That's the benchmark plan. And the way the formula works is that you should have to pay no more than 8.5% for the second lowest cost Silver plan. If that second lowest cost Silver plan is 10% of your household income, then the difference in dollars is between 8.5% and 10%. And so obviously that's going to change as your income goes up and the annual rate of the second lowest cost Silver plan shrinks as a portion of your income. Obviously, the subsidy gets lower. Another factor is that California is made up of 19 different rating regions, all with different rates. Specifically, Northern California is more expensive than Southern California. So if we look at a couple, both ages 55, with an income of $200,000, the annual premium for the second lowest cost silver plan after the subsidy is 17,004 pennies, which, if you do the math, is 8.5% of their income. The difference is made up by the subsidy of $738.21. So obviously, the health plan is up there around 10% or more of their household income. So the subsidy brings it down to 8.5%. Now that's for the second lowest cost silver plan. This couple can take that $738 and apply it to any plan they wish at Covered California, bronze, gold, platinum, but the benchmark plan is that silver plan. Now, that couple decides to move to Santa Monica and live on the beach, or wherever you live on Santa Monica. But the health insurance rates are much less expensive down in Southern California, and the cost of the second lowest cost silver plan, the annual cost is $14,743.44 from LA Care. With a $200,000 income, that's less than 8.5%. It's 7%. So there is no subsidy for the same couple, and it's all based on the region where they live and of course the cost of that second lowest cost silver plan. So that's something else you need to be cognizant of and shop around. You may have friends in Northern California that say, I'm getting a huge subsidy, baby. And you're looking, because you live down in Palm Springs, and I'm not getting anything. I don't qualify, and I don't make that much money. So that's something you have to, the shop and compare tool through Covered California is very good. They have it updated as of April 12th. So you should be able to get that kind of information to see if it works. Now, let's say it does look good for you to go into Covered California. This is a caution. On the income section, you need to be careful. Now, Covered California screens for Medi-Cal for your monthly income, not your annual income. So when you are putting in your income, especially if you have fluctuating income, you need to capture all of your annual income. So if you're coming in, for May or June, you need to make sure that you've included the income you've earned from January up to that point. You just don't want to, otherwise it'll show that your annual income is too low. If your income fluctuates, maybe you get paid, $10,000 every other month. If in the month you apply, you do not list any income, you will be determined eligible for Medi-Cal. So oftentimes what you need to do, like in this particular, on the self-employment income for Dante, we just took it as $26,000 and we made it an annual amount. We didn't say that he made it every month. We said it was an annual amount. The Covered California system will then take that $26,000, chop it up into 12 equal increments, and call that the monthly income from that income stream. So there's little things you need to look at when you're going through the income section, because yes, I have seen people make a lot of money, but if the income section is so date sensitive, they got thrown into Medi-Cal and they weren't eligible for Medi-Cal. One thing we're not entirely certain of, because the whole American Rescue Plan is kind of new, IRS is still working on all the guidance, we don't know what the repayment limitations are going to be or the tax consequences. You always reconcile these premium tax credits when you file your taxes. Now, for income taxpayers up to 400%, there is a repayment limitation. So if they came in with a low income and they made more money, they will not have to pay back all the subsidies because it's limited, as you can see on the screen here, for a household of two or more. Up to 400%, they're limited to repay $2,700. Even if they received $5,000 in excess subsidy, they're limited to $2,700. We're not exactly certain how it's going to work for those upper income earners that are making 500, 600, 700% of the federal poverty level. Worst case scenario is that I can see is that if your final modified adjusted gross income when you do your taxes is high enough that it makes the second lowest cost silver plan less than 8.5% of your household income. And perhaps when you went into Covered California, that second lowest cost silver plan was closer to 10%, so you got a subsidy. But if your final modified adjusted gross income is such, like that Southern California couple, where it was like 7%, you may have to repay all of the subsidies that you received during the year. So that's something to think about. However, you do not have to take the monthly subsidies through Covered California that is offered to you. You can dial it back to 0. And many people do this. They'll go into Covered California, select their plan. Maybe they're eligible for $1,000 a month. They say, no. They dial it back to 0, pay the full amount. And then when they reconcile their taxes, that's when they claim the credit. Because all the premium tax credit is an estimate of what the subsidy should be, chopped up into 12 equal increments, and then sent to your health plan to lower the cost. But you don't have to take it. You can just take that $10,000 or $12,000 or $15,000 health insurance subsidy when you do your taxes. And if your income's too high and you don't get a subsidy, then, no harm, no foul, unless you were in a silver plan where you paid too much because it would have been cheaper going off exchange. So I know there's a lot of different things going on. So it isn't just a quick snap decision, just like that Covered California may lead you to believe from the advertising. If you're in an off-exchange plan, there is a reason for that. And you have to consider all of the reasons why you're in that plan and if there is significant benefit to enrolling through Covered California to lower your health insurance costs for you and your family. So I'm Kevin Knaus with InsureMeKevin.com. If there's any questions I might be able to answer, you can leave them down in the comments section. You can go to my website, InsureMeKevin.com, and contact me there or give me a call on the phone.